Okay, we're back. I thought I would cover some more about therapeutic communication. Therapeutic communication in mental health nursing especially seems to be, from my experience, something that students struggle with in answering test questions. So the more of these that you can go through and read the rationales, not just quickly go through 100 questions, but to go through them, take your time, read the stem of the question, read the answer choices, and then once you find out what the answer is, read the rationales from your book, of course, always. And that will help you to practice this type of question. Okay, so here we go. So this first one is, a nurse states to the client, things will look better tomorrow after a good night's sleep. This is an example of which communication technique? Okay, and so here are the answer choices. Number 1, the non-therapeutic technique of giving advice. Number 2, the therapeutic technique of formulating a plan of action. Number 3, the therapeutic technique of presenting reality. And number 4, the non-therapeutic technique of giving false reassurance. Okay, so you can pause this video if you like and try and figure out what the answer is, this one. And then we'll go through the answer choices and I'll tell you which one is the correct answer. Okay, so let's take a look at this one. This one is what you're looking for here is an example of a communication technique. So I mentioned before in my other video that there are therapeutic communication techniques and there are non-therapeutic communication techniques. And this is in the area of mental health, psych, nursing content. These are the types of questions you may see on your NCLEX. And I've had students, former students, contact me after they take their NCLEX, and they're like, Dr. Hart, I am shocked. I am really surprised. I was really surprised at how many mental health nursing content questions were on my NCLEX. So you may think it's no big deal, but it really is. And there can be some questions on your NCLEX. And in other videos, I will also go over some of the psychiatric medications. And those are important as well. Because you also, with psychiatric medications, you're going to be using those on a med-surg floor, not just in a psych unit. You're going to be using lorazepam, and you may use Haldol or haloperidol. You may use any of the benzodiazepines. You may use the antipsychotics. You may use especially the antidepressants because your patient coming into the regular floor might be already taking those medications and the doctor may order to continue those. So you must know, even on a med-surg floor or the ER or even OB and maternity, labor and delivery floor, you should know about the psychiatric medications. Okay, so let's go through the answer. Okay, so the answer for this one is number 4 is the correct answer. This is a non-therapeutic technique of giving false reassurance. Okay, false reassurance is where you're telling your client it's okay, it's going to be okay, everything's going to be okay, tomorrow's going to be a better day, look on the bright side, it's going to be fine. But as a nurse, we don't know that it's going to be fine, so we really can't make those promises to our clients. So that's giving false reassurance when you say things will look better after a good night's sleep. So we have to, as nurses, be careful about saying things like that to our client, because if they don't turn out okay, then they're not going to feel like they received very positive care from you, okay? And we want to have positive outcomes. So let's go through these other answer choices. So the giving false reassurance indicates to the client there's no cause for anxiety. Therefore, you're devaluing the client's feelings. And there's another test question in here too that kind of covers the same topic. Number one, answer choice, the non-therapeutic technique of giving advice. So you're not really giving advice here. Giving advice would be like, oh, I think you should stop smoking. I think you should stop drinking. You should really start going to AA meetings. That's giving advice. Number two, therapeutic technique of formulating a plan of action. So when the nurse is formulating a plan of action, you're talking with the patient and you're talking about what their goals would be, what goals you want to write out for yourself, how would you get to those goals, how much time would you give yourself to get to those goals, what would you do to make those happen. That's formulating a plan of action. Number three is the therapeutic technique of presenting reality. So presenting reality would be like, for example, if you have a patient who suffers from schizophrenia and they're having a hallucination and they're seeing someone sitting in the corner. Presenting reality would be like when you say something to the client like, it must be scary for you to see that person in the corner, but I don't see that person. So that's presenting, that's keeping your patient grounded to reality. And number four, of course, is the correct answer. That is the non-therapeutic technique of giving false reassurance. Okay, and that blocks the patient's feelings. It doesn't give them the opportunity to share how they really feel. It's like cutting them off. Things are going to look better after a good night's sleep. Okay. All right, let's go to the next one. Which action by the nurse who is first meeting a client would likely send a nonverbal message that is inappropriate for the therapeutic relationship? So, and with communication, there is verbal communication and there's nonverbal communication. Okay? And so, which action would likely send a nonverbal message that is inappropriate for the therapeutic relationship? Okay, choice number one. The nurse provides eye contact intermittently during the meeting. Number two, the nurse is dressed in business casual attire. A tattoo is visible. Number three, the nurse offers a handshake during initial interaction with the client. Or four, the nurse gives a client a strong hug at the end of the meeting. Okay, and so look this over, give it some thought, and you can pause this. I'll give you a second to pause this. See if you can come up with the answer. When we come back, I will go over the answer. Okay, we're back. Okay, so this one, what did you think? You're looking for something that is an inappropriate nonverbal message. So that's not you talking, that's the nurse doing something. Right away, that's a clue. Okay, nonverbal message. What would be inappropriate? So let's go with number one. The nurse provides eye contact intermittently during the meeting. Is that inappropriate? No, that's not inappropriate. That's fine. Intermittent eye contact is perfect. You don't want to constantly be staring at your patient, right? You want to be looking different places and not looking straight at them all the time, because that can be intimidating to the client. So it's not number one. Number 2, the nurse is dressed in business casual attire. A tattoo is visible. So business casual attire, sometimes nurses, especially with higher degrees, sometimes in doctor's offices, don't always wear scrubs. So business casual attire is fine, and a tattoo is fine. Nowadays, tattoos are more acceptable. I mean, you don't want to be completely covered, especially the face and the neck. But if you have a tattoo visible, I feel it's fine. It's appropriate. Okay, so it's not that one. Number 3, the nurse offers a handshake. Now, don't forget, we're looking for inappropriate, something inappropriate. The nurse offers a handshake during initial interaction with the client. Well, again, a handshake is perfectly fine. Handshake is when you're first meeting a client, especially if you're doing the initial assessment interview, you want to get to know them, help them feel relaxed. You can offer a handshake, that's fine. Okay, and number 4, let's look at that one. The nurse gives the client a strong hug at the end of the meeting. Okay, so this is definitely inappropriate. So this is inappropriate behavior for the nurse. Okay, number 1, especially in a mental health psychiatric environment, right, in a mental health psych unit. The nurses generally do not touch the patients unless they're taking a blood pressure, pulse, or something else. And in that case, you're going to ask permission to touch them first before you even put a blood pressure cuff on. With any client, you should ask permission first before you touch them. But in a psych unit, you have to be careful about it, and I'll talk about this later when I talk about patients with, for example, schizophrenia, who are having delusions. Their perception of touch may be different than someone else's. They may feel touch as being intimidating or make them anxious or being a threat. Touch may be threatening for them. So a strong hug is inappropriate, and that's something that shows an attraction or attachment to another person. So that's definitely inappropriate in the mental health, any unit really, inappropriate. You should keep your boundaries with your patients, and should not be touching them unless you have a reason to. Okay, so be careful about that. All right, next. Which nursing statement is a good example of a therapeutic communication technique of giving recognition? Okay. All right. So let's start with, I'll give you the answer choices. Number 1, you did not attend group today. Can we talk about that? Number 2, I'll sit with you until it is time for your family session. Number 3, I noticed you're wearing a new dress and have washed your hair. And number 4, I'm happy that you are now taking your medications. They will really help. All right. So I'm going to pause talking for a minute so you can pause the video and you can think about your answer. And then when we come back, I'll give you the answer. I'm going to take this opportunity to just take a second to please ask if you are enjoying this content, if you're getting something out of it and you want to see more of my videos. Please like and share and subscribe if you like to my YouTube channel. I'm also going to be sharing these on TikTok, Facebook, other social media platforms, LinkedIn I have, Instagram, all of those. So you may see these on those different platforms. All right, so we're back. So which nursing statement is a good example of the therapeutic communication technique of giving recognition? Okay, So this situation sounds like it would be if you're dealing with a patient who is severely depressed. And so this may be a patient who is typically not combing their hair, not getting dressed, not taking a shower. And we can't make them, we can't force our patients to do any of those things. Even in an involuntary, I talked about in my other video, involuntary Baker Act commitments. Baker Act is state of Florida. Other states call it something different. But that's the 72-hour hold that will determine whether or not the patient is at risk of harming themselves or others. And so they go to a unit where they get assessed by the psychiatrist, and then the treatment team determines if it's okay for them to be released after the 72 hours. So the answer on this one is number 3. I noticed you're wearing a new dress and have washed your hair. Okay, so you're giving recognition. So for example, this is your depressed patient who hasn't been taking a shower. They haven't been putting on clean clothes. They haven't been washing their hair. And I've seen many patients like this in the units that I've taken, where I've taken my students. They are obviously not showering. They're not brushing their hair. And those are sometimes the people who are severely depressed. So you want to give recognition for their efforts. I notice you're wearing a new dress and you washed your hair. So that's a good thing. You want to give them recognition. You want to acknowledge and let them know that you're aware that they're doing this and they're taking that effort to improve their personal hygiene, because personal hygiene is very important for their recovery. With number 1, you did not attend group today. Can we talk about that? That's just you making a general statement, and you're making an open-ended statement. Can we talk about it? Number 2, I'll sit with you until it's time for your family session. Number 2, you're offering self. That's another therapeutic technique. You're offering yourself. You're offering your time to sit with them until it's time for the family session. Okay, and number 4, I'm happy that you're now taking your medications. They will really help. That's just a statement, general statement. Okay. All right. So let's go on to the next one. Okay. All right. The question is, a student nurse is learning about the appropriate use of touch when communicating with clients diagnosed with psychiatric disorders. Which statement made by the instructor best provides information about this aspect of therapeutic communication? All right, this is the question I was talking about earlier when it comes to touch. Okay, here are your answer choices. Number 1, touch carries a different meaning for different individuals. Number 2, touch is often used when de-escalating volatile client situations. Number 3, touch is used to convey interest and warmth. And number 4, touch is best combined with empathy when dealing with anxious clients. Okay, so I'm going to give you a second, and then we'll come back and talk about the correct answer. Okay, we're back. Okay, so in this case, number 1 is the correct answer. Touch carries a different meaning for different individuals. Okay, so that means, like I mentioned, in most cases, touch in a patient, when you're dealing with patients who have psychiatric disorders, touch is not appropriate unless you're taking a blood pressure and then you ask permission before you touch them. Touch can have a different meaning for different people. So, like I gave the example earlier, that clients with, for example, schizophrenia may be having delusions, hallucinations, a lot of things going on. They may be having a really tough time. Touch for them is going to carry a different meaning and may be very threatening for them. Touch generally is not recommended at all, okay? Touch can give both negative and positive reactions depending on the people that you're dealing with. But with mental health patients, in most cases, it's going to be it may be a negative reaction. So we have to be very careful about that. Okay, let's go over the other answer choices, 1, 2, and 3. Touch carries a different meaning. I'm sorry, 2, 3, and 4. 2, touch is often used when de-escalating volatile client situations. No, touch is not used when de-escalating. We don't touch the client, okay, in de-escalation situations. Number 3, touch is used to convey interest and warmth. No, we do not. It is not used. Okay, and number 4, touch is best combined with empathy when dealing with anxious clients. No, you're not combining it with your empathy, okay? Empathy. So you can see where these other answer choices 2, 3, and 4 are saying that touch is okay. Well, it's not in a psychiatric unit, okay? Just remember that. Okay, next. During a nurse-client interaction, which nursing statement may belittle the client's feelings and concerns? All right, number 1. Now we're talking about something that's bad or negative, right? We're belittling the client's feelings and concerns. It's something that you don't want to say to your client. Number 1, don't worry, everything will be all right. Number 2, you appear uptight. Number 3, I notice that you have bitten your nails to the quick. And number 4, you are jumping to conclusions. All right. I'm going to pause for a minute and come back and we'll go over the answer and all the other answer choices. Okay, we're back. So the correct answer is number 1. Number 1, okay? We're belittling the client's feelings and concerns when we say, don't worry, everything will be all right. Because, okay, this is an example of the non-therapeutic communication, which is called false reassurance. False reassurance blocks the client's communications, it blocks their feelings, and the nurse is misjudging how discomforted the client is, and as the nurse is having a lack of empathy and understanding when the nurse says something like that. Okay. Number 2, you appear uptight, and that is incorrect. Okay. It's not an example of non-therapeutic communication, blocking of belittling feelings, blocking or belittling feelings. Okay, that's just a statement. That's an observation. You appear uptight. Number 3, I notice you have bitten your nails to the quick. That's another observation. Okay, that is the therapeutic communication technique of making observations. So that's okay to say. I notice you've bitten your nails to the quick. That's an observation. Number 4 is incorrect. You are jumping to conclusions. Okay, you are jumping to conclusions is another observation. Okay, it's not belittling clients' feelings and concerns. All right, let's go on. Which nursing response is an example of non-therapeutic communication technique of requesting an explanation? Okay. Okay, and so this goes back to something I mentioned on a previous video, and I'll go over that. Okay, number one is, can you tell me why you said that? Number two, keep your chin up. I'll explain the procedure to you. Number three, there is always an explanation for both good and bad behaviors. And number four, are you not understanding the explanation I provided? Okay, and I'll give you a second to think about this one. Okay, we're back, and the correct answer is number one. Okay, the non-therapeutic communication technique of requesting an explanation is number one. Can you tell me why you said that? So the clue there is the word why. So be careful about why questions, especially when you're answering NCLEX-style questions. So what you're going to have when you're in nursing school, while you're in nursing school, you're in NCLEX world. NCLEX world is different than the real world. Try not to confuse situations and compare situations that you may see when you're in your clinical setting, or if you're working as a preceptor or an extern in a unit, hospital unit. What you see and hear there is not going to be what you want to bring into the classroom when you're answering these questions, because so many times I see students get confused. But I saw the nurse do that. And I saw the nurse didn't wear sterile gloves for that procedure. And I saw the nurse, I heard the nurse say that to the patient. Don't go by that, what you see and hear in a unit, okay? Go by what is in your textbook and what you see here on my channel, okay? Because this is what will help you. All right. So number one is correct. Tell me why you said that. This is an example of the non-therapeutic communication technique of requesting an explanation. Okay, this is when the client is asked to provide the reason for their thoughts, feelings, behaviors, and events. Asking why the client did something can be intimidating to them and puts them on the defensive. It makes the client feel like they have to defend their feelings. So we don't want to do that. Okay, it's not number two. Keep your chin up. I'll explain the procedure to you. Number three, there's always an explanation for both good and bad behaviors. Okay, you're not requesting an explanation there. And number four, definitely not, are you not understanding the explanation I provided? Okay, that's not a very good statement either to say to your client. Okay, all right, let's go to the next one. Okay. All right. So next, the nurse observes a client sitting alone and crying after a group therapy session. The nurse sits in the chair nearest to the client and states, "I see you're crying. I'd like to sit with you for a few minutes. Which communication technique is the nurse using? Okay, the nurse is sitting in the chair near, close to the client and states, I see you're crying. I'd like to sit with you for a few minutes. Okay. All right. Answer choices. Number 1, making an observation. 2, offering a general lead. 3, presenting reality. Or 4, silence. Okay, so I'll give you a minute to think about this and we'll come back with the answer. Okay, we're back. All right, so this one you're looking for what communication technique this is. All right, you're sitting next to a client and they're crying. I see you're crying. I'd like to sit with you for a few minutes. Okay, and the correct answer is number 1, making an observation. You're observing that the client is crying. That easy, right? Number 2, it's not number 2, offering a general lead. You're not, a general lead is, I covered this one on a previous question. Offering a general lead, for example, is, yes, I see, go on. That's a general lead. Presenting reality, that's a previous question that I went over, where you're talking with a client with schizophrenia who says they see someone in the corner who is not there. You're going to present reality and you're going to say, it must be scary for you to see someone in the corner, but I do not see them. Okay? And number 4, it's not silence. You're talking with the client. You're not being silent. So that's pretty easy to figure out, right? You kind of have to use process of elimination with these test questions and slow your pace down. Okay, when you're taking these tests and exams and standardized exams, you have, most of the time, you have a banner or something that shows you how much time you've used up. So you can judge with practice, you can judge how much time you have, how much time it's going to take for you to answer each question. But generally, I see students sometimes try to go too fast. So slow it down, read the stem of the question a couple of times, read each answer choice, and don't just say, boom, I know what the answer is, it's that one. You have to closely look at the other answer choices. Okay? All right, last one. Which nursing response is an example of a non-therapeutic communication technique of requesting an explanation? Did I already do that question? Oh, let me see. We'll go over it anyways. Okay, so here, the non-therapeutic communication, so that's a bad communication, right? Technique of requesting an explanation. Number 1, can you tell me why you said that? Number 2, keep your chin up. I'll explain the procedure to you. Number 3, there is always an explanation for good and bad behaviors. Number 4, are you not understanding the explanation I provided? Okay, I think I did go over this before, but I'll do it again. Okay, give you a minute to come up with the answer. All right, and we're back. Okay, and correct answer is number 1. We're looking for non-therapeutic, requesting an explanation. Okay, number 1, can you tell me why you said that? Okay, that's a why question. Look out for those. That's a clue that it's non-therapeutic. The second one, number 2, keep your chin up. I'll explain the procedure to you, is not requesting an explanation. Number 3, there is always an explanation for good and bad behaviors. You're not requesting an explanation. And number 4, you're asking a question and it's not a very good question. Are you not understanding the explanation I provided? Okay. All right, so that's it for today. And again, if you like these content questions, these are NCLEX-style questions. They're good to practice with. If you like these, please like, share, and subscribe to my channel. And have a good day, everybody. See you on the next one.